Conditions involving the foot, knee, and hip are very common in clinic. We see a wide variety of conditions such as plantar fasciitis, Achilles tendinitis, IT band syndrome, patello-femoral syndrome, hip impingement. Now, what all these conditions have in common is a disconnect of the foot from the trunk and core. Now, a lot of times people will be told the solution to their problem is just to make everything stronger. The problem with that is stability and movement patterns really have very little to do with strength. It's all about coordination. Does the brain know where the foot is? Does the brain know how to connect the foot and the hip to the trunk and core? Today we're going to be using the high kneeling position to train ideal loading patterns of the foot and hip. We're going to demonstrate setting up the initial position from a variety of different views so that you have a really good idea of how to set yourself up for this exercise and ensure the best possible outcome. So let's get to it. So before we begin the active exercise, it's important that we establish the initial position, creating ideal support. Now, what we want to make sure is that the two extremities are positioned so that they're roughly shoulder width apart. So this knee is going to be about the same width as this shoulder and this foot equal to that one. So she's a little bit narrow in her stance. So I'm going to have her move her foot out just a little bit. Now next, we also want to make sure that the center of her body is distributed evenly between the two lower extremities. Typically what we'll see people do is they want to avoid loading their support foot, so their weight's going to shift over towards their back knee. We want to have this ideal distribution between the two, like so. The back leg is going to be slightly in external rotation, so we want the knee to be inwards just a little bit from the hip joint like this. So hip position, lower extremity, foot like this. Now next, we see that she's in a bit of a side tilt. So when there's a lack of relaxation of the gluteal muscles on this side, it's going to hike up the hip on that side. So she has to relax through here, allowing the pelvis to drop into that ideal position. Next, we look at the trunk, and we don't want to see side bending of the trunk, nor do we want to see the trunk in any kind of a twist. So no rotation, no side bending, and the pelvis in its neutral position, and the head not rotated or side bent either, but right over top of the trunk. So that is setting up the basic position from the back. Next, we're going to look at how to set up from a front view. So now we're going to look into how to set up the basic position from the front view. Now, ideally, again, we want to make sure that the two lower extremities are positioned properly. So we want the foot to be the same width as the shoulder. And you can see from here that we're not having an ideal position. So I'm going to have her move her heel outwards just a little bit. But we also want to make sure that the long axis line of the foot is the same as the femur. So we're going to keep the heel here, but slightly turn the forefoot out, like so. Next, we want to make sure that the center of the knee is going to be aligned with the second or the third toe. So we don't want the knee dropped inwards, overloading the inside of the knee or the medial arch of the foot. So the knee has to be in the proper position in this direction here like this. We also don't want to see the hip kicking out to the side, but into a more neutral position. So the hip drops down and it's right under the trunk like so. The hand is going to be positioned in front of the body so that the middle finger is relatively pointing straight forward, and the shoulder is going to be in external rotation so that the dimple of the elbow is in the same line as the thumb. So the shoulder externally rotates. We want the shoulders to be spread as wide apart as we can. There's not going to be any head tilting or rotation, it's pulled back into the proper position like so. So now we have alignment of the head over the trunk over the pelvis, the body is positioned evenly between the two lower extremities. She's established her hand support, her foot support, and she's ready to create the active exercise. So now we're going to show you how to establish the basic position from side view. Ideally, we want the foot to be positioned 6 to 8 inches in front of the back knee, and where she is right now is quite good. We're going to bring the knee into position by bringing it forward so that it is roughly in line with the toes. The idea is to set everything up so eventually her center of mass is going to be right over top of her foot. If the knee comes too far forward, we're going to be creating a lot of knee loading. And if she's too far back, it's going to find difficult to upright herself because her center of mass is going to be too far backwards. So the knee comes forward so it's in line with the toes. Next, we have to position the pelvis correctly. Now, we don't want to see the pelvis rotated backwards, creating that rounded back position, nor do we want the pelvis to be too far forward in tilt, creating this sway back position. But we're simply going to rotate the pelvis back and forward, bringing it into that ideal neutral position by rotating around the hip joint. Next, we're going to align the trunk relative to the pelvis. And to do this, we're just going to use a wood dowel, a broomstick or such will work fine as well. Now, placing the dowel on the back of her pelvis, connecting it to her thoracic spine, bringing her head back so everything's in contact. You know, if she had too much thoracic curvature and her back was humped, we're going to see what that would look like. So again, she's just going to allow her back to straighten and the head comes in contact with the bar like that. It's really important that we maintain this upright position throughout the entire exercise. So we need to keep this in mind, developing a good feel of what this is like. Now, the next position that we have to establish is how to bring the center of mass over the foot. So keeping this relative alignment that she has, she's going to lean her body forward to bring her body, her center of mass, onto her foot. And as she's leaning forward, she should feel her foot beginning to be loaded. She's going to reach forward a little bit with her left hand, so right foot loading, left hand loading. So the left hand is in that position in front of her, and the shoulder joint is going to be slightly externally rotated. We don't want to have the shoulder in an internal rotation position, so she's going to be rotating her shoulder into external rotation, bringing the elbow inwards so that we have ideal hand-shoulder support. The idea is to connect the whole body between the two support points. So there is your basic position. Next, we move into active exercise. In the active exercise, the intention is to go from a kneeling position, moving forward and upwards towards standing. So what she wants to feel is the intention. It doesn't have to be the actual movement, but the intention of coming up. She's not going to be coming up vertically. She's going to be coming up in the direction that her body's pointing. So basically, she's going to be moving forward and up, kind of straight through the top of her head. The movement is going to be creating this cogwheel effect of the femur uprighting over the tibia and the pelvis pulling up over the femur. Now, usually what people will tend to do is when they want to come up, they're going to simply push their knee backwards to come up. But we want the knee to always be into this position, right in line with the toes. And so essentially what she's going to be doing is lifting her femur up and over the knee. This is a lot more difficult to do than simply pushing the knee backwards to come up. So we want the gluteal muscles to lift the body, not the knee to push back, bringing the body upwards. So she's going to really work on creating and maintaining that proper position. The hip drops down. We want to feel that ideal pressurization through the whole cylinder. So with my hands around her waist, I want to feel her expand that abdominal canister with pressure, holding it tight into my hand. She's going to load her support hand, pushing down and feeling like she's trying to drag her hand back, or actually pulling herself forward through her hand. Knee stays here, load her hand, her head keeps pulling back like this, helping to create an uprighting of the trunk, while the pelvis is going to lift up and over the knee. Now we don't need to have a lot of movement, it's just loading through the foot, the entire foot. And she's going to hold this position for several breaths. I want to feel that pressure in the canister while she breathes into my hand. And back. Good.